Simon and Joe both invest in stocks.
Simon and Joe. Welcome. If there's any Simons and Joes out there in the world, welcome Simon and Joe. So Simon and Joe, whoa, Joe, what are you doing? A little, right there. Anyway, we're going to get into this. This is some serious information and, you know, making light of the situation, I guess, doesn't help, or it doesn't hurt. So, well, yeah, the World Health Organization just did an update a couple hours ago. I'm kind of a little bit behind the times. You know, I got my life going here too as well. My son and lunch and everything and cleaning and trying to get stuff organized. So yeah, I missed this update, but we're going to go through it right now. I kind of just did a quick glance over it, but it is, yeah, it's okay. You know, they're giving public health advice, telling people, you know, this is on the local media sources saying, hey, you know, giving us a voice on levels of, I guess, risk assessments, you know, saying, well, the public risk is low right now, and this and that, and this and that, and this and that. I knew this from day one that this was some scary ass whatever. And it's not that anything I want to be right about. It's not that I like to be vindicated on this at all. So we're going to check out here. Let's listen. You know, and then I'll give you my kind of perspective. We'll go through this, and this is my opinions, right? And I'm just looking at factual information from around the world, and I'm going to show that to you. I'm going to show you some data, and you know, you can make your own formulations and your own decisions based on what you see. And this isn't anything to cause alarm or cause panic. You know, alarm maybe, but panic, no. Panicking doesn't help you. Panicking will, in fact, decrease your immunity, because it takes a lot of energy to panic, and you know, it does. Fear is a good thing, but you know, over is not too much. Fear helps us be heightened and it be a extra sensory and aware, you know, like of our surroundings a lot more. So that's a natural defense, and let's use that. You know, those are our primal instincts, which may come into yeah. So anyway, we might need those soon. And again, not to cause panic, it's not, it's real, and I'm just calling it the way it is. And people need to come to this together. And you know what I mean? Like, it might be a little different for China, but I think there's going to be some heavy action. And I don't know, they're waiting on scientific data, right? Anyways, let's go.
To all journalists online, we hope that today the connection will be much better than what we had yesterday, and we will take maybe a few more questions from journalists online today. Welcome to everyone watching us online. As always, we will have an audio file available immediately after. For those here, just to remind you one more time that we will have to leave this room immediately after the press conference, and we hope to finish the press conference by quarter two, because the room is needed for another meeting. And I will, with that, give immediately floor to...
Okay, wait, the room is needed for another meeting? You have the World Health Organization in a room giving fucking global fucking... Wow. Okay, I'm sorry, sorry. That's my expression. I'm not a gangster, and I don't try to be, but I curse a lot sometimes, you know. It's just an expression, a form. Because they're so descriptive in certain cases, and wow, telling people that. Anyways, yeah, you guys got to get out of here. There's a birthday party here afterwards, so you know, you guys got to go. Oh, fuck off. That's just giving you know, an example to say, okay, you know, it's kind of because they try to get these guys to stay around and ask them questions and all this stuff to reporters, right? So it gives them a reason to fucking like an exit strategy. Anyway, let's go.
Director General Dr. Tedros. And we have Dr. Maria, and we have Dr. Mike Ryan with us today. Dr. Tedros.
Thank you, Tariq. Good afternoon once again, and thank you for joining us. First, the latest numbers of the outbreak. As of 6 a.m. Geneva time today, there were 28,060 confirmed cases in China, and 564 deaths. Outside China, there are 225 cases in 24 countries and 1 death. Yesterday, as you know, we launched our strategic preparedness and response plan asking for 675 million US dollars to investing in stopping this outbreak. As I mentioned, the Bill and Melinda Gates Foundation has already made a generous contribution, and Japan has also made a contribution of 10 million US dollars today, and there are a lot of other signals of support. We expect more announcements in the coming days. We welcome support from all donors, big and small, because every dollar counts. We are also mobilizing the full power of the UN system. After our press conference yesterday, I briefed the Secretary General and other UN leaders, and today we had a call with more than 200 UN country representatives in more than 200 countries. This follows yesterday's call with WHO country representatives. It's hard to believe that just 2 months ago this virus was unknown to us. We have already learned so much about it. We know its DNA. We know it can be transmitted from one person to other. We know that those most at risk are older people and those with underlying health conditions. Having the genetic sequence of the virus has enabled the rapid development of tests, and as I mentioned yesterday, we have shipped 250,000 tests to more than 70 labs around the world, and we're training lab workers to use them. But there is still a lot we don't know. We don't know the source of the outbreak. We don't know what its natural reservoir is, and we don't properly understand its transmissibility or severity. To defeat this outbreak, we need answers to all those questions. And there are tools we don't have. We have no vaccine to prevent infections and no therapeutics to treat them. To put it bluntly, we're shadow boxing. We need to bring this virus out into the light so we can attack it properly. That's why on February 11 and 12, we're convening a global research and innovation forum to identify research priorities and coordinate the international research effort to find therapeutics and vaccines. This will be a meeting of scientists from all over the world, including China, both in person and virtually. The aim is to fast-track the development of effective diagnostic tests, vaccines, and medicines. One of the key challenges is coordinating research funders to support key priorities. A lot of donors want to help, but we need to direct them to support agreed priorities rather than going off in different directions. I have said we need to be led by facts, not fear, and science, not rumors. That's exactly what we're doing. We're letting science lead. But this is not something we have only just thought of. This is something WHO has been working for years. Following the West African Ebola outbreak, we developed the WHO R&D
blah, 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 blah.
a global strategy for developing drugs and vaccines before epidemics and accelerating research and development activities during epidemics. It speeds up the availability of the medicines and technologies that save lives. We have seen that with the rapid development of an Ebola vaccine. But vaccines and therapeutics are not silver bullets, and they will take time to develop. In the meantime, there are simple things everyone can do. Wash your hands regularly and cover your nose and your mouth with your elbow when you cough or sneeze. That's personal hygiene. Keeping the world safe is in our DNA. If countries invest now in prevention and research, we can avoid more cases and more costs down the line. I thank you.
So
back to you, Tariq.
Yeah, their funds are actually pretty tapped right now because they are dealing with a measles outbreak in Sudan, and there's I think there's still something going on in Africa that's requiring a lot of resources at this time. So the Bill and Melinda Gates Foundation, they pumped $100 million into this, and there's other people wanting to do donations, but they want to put them to a specific cause. You know what I mean? Like they want to be like, oh, I want to put this in this area for these people. Well, you can't do that. You know what I mean? Like they're saying basically, yeah, like they need to have control of where the money goes for the most important reasons. Like we're not just going to take your money and give it to specific areas that you want us to. But anyways, let's just continue with this. There's a lot of information in here, and what they basically said too is that they still have no idea of its vessel. Let's just go through that again. They don't know where it came from or anything. So I think this is where it's queued up at. Let's just check this out.
This virus was unknown to us. We have already learned so much about it. We know its DNA. We know it can be transmitted from one person to other. We know that those most at risk are older people and those with underlying health conditions. Having the genetic sequence of the virus has enabled the rapid development of tests.
And now he says the older people, but these are numbers that China is actually giving, statistical numbers that China is giving with no oversight. They're claiming that there's, who knows, right? But we're going to get into this a little later, but take that with a grain of salt. Everything they're saying here is statistical analysis that they're running from basically all of China, because there's no big outbreaks really anywhere else in the world. And at the moment, there's no oversight in China, but they do have a technical team going in there to get firsthand, data on what's happening. And they do have 250,000 tests that they conducted themselves and sent to the labs, and most of them are from China. So it's going to give them a better data set to kind of figure out what's going on here, because basically, no matter what they might think is going on or assume is going on, they're relying on factual data, and you'll see why that comes into effect up here later in about policy and procedure, and how we are all just statistics right now, and nothing's being done, even though it is a bad situation, because the scientific data is just not there yet. So yeah, catch-22, right? So anyways, let's just keep going through this.
And as I mentioned yesterday, we have shipped 250,000 tests to more than 70 labs around the world, and we're training lab workers to use them. But there is still a lot we don't know. We don't know the source of the outbreak. We don't know what its natural reservoir is.
We don't know what its natural reservoir is, meaning where it's coming from. And they don't know. So that's huge. That's huge. Okay, so they said that they have the DNA, they have the sequences, right? They would be able to know right away when they have that DNA where it came from, or at least the animal suspected, right? They would. They did that in the past. You can go research it. But what they're saying here is that there's a high probability now that this is something that got out of a laboratory and is not natural but man-made, because they're saying they don't know the vessel, right, or where it's coming from, right? Let's listen to that again, exactly what he says.
We don't know the source of the outbreak. We don't know what its natural reservoir is, and we don't properly understand its transmissibility or severity.
See? They don't properly understand it, so the scientific data is not there. Well, we've all seen the images, and we've all seen the stuff coming out. We've all seen the cruise ships on quarantine. There's people being hauled out. This isn't anything like you ever could imagine. Like, people are comparing this to SARS and Ebola and all these past outbreaks. No, it's not. It's completely wrong. And they are factual, scientific based driven panel here. Like, the World Health Organization needs scientific data to show the world, in order to make these great big next steps, like kind of China did. But, the only way to stop this is to separate people. But anyways, we'll go into all this after, and we'll continue on with the broadcast here. So yeah.
To defeat this outbreak, we need answers to all those questions. And there are tools we don't have. We have no vaccine to prevent infections and no therapeutics to treat them. To put it bluntly, we're shadow boxing. We need to bring this virus out into the light so we can attack it properly.
They're going to give an update soon. They probably have a very good idea that this came from the lab, right? But they have to do ridiculous amounts of data analysis, and that's why they're going to get the world's top scientists all together on this. Okay, this is coming up in a few minutes, but it's big. They said they need to bring it out into the light, and I wouldn't be surprised if we hear very soon that this is something that got out of containment somewhere. So let's just go.
That's why on February 11 and 12, we're convening a global research and innovation forum to identify research priorities and coordinate the international research effort to find therapeutics and vaccines. This will be a meeting of scientists from all over the world, including China, both in person and virtually. The aim is to fast-track the development of effective diagnostic tests, vaccines, and medicines. One of the key challenges is coordinating research funders to support key priorities. A lot of donors want to help, but we need to direct them to support agreed priorities rather than going off in different directions. I have said we need to be led by facts, not fear, and science, not rumors. That's exactly what we're doing. We're letting science lead.
Letting science lead. So they're not making any humanitarian decisions, even if they feel like this should be something they need to make a decision on and they want to. It's a panel of people, and they're around the world, different nations, and they want scientific evidence before, going ahead with this, because you know why? Money, markets, trade, global economy. Anyways, let's just keep rolling. Let's hope they find the science soon.
This is not something we have only just thought of. This is something WHO has been working for years. Following the West African Ebola outbreak, we developed the WHO R&D blueprint, a global strategy for developing drugs and vaccines before epidemics and accelerating research and development activities during epidemics. It speeds up the availability of the medicines and technologies that save
They need more
lives.
money.
We have seen that with the rapid development of an Ebola vaccine. But vaccines and therapeutics are not silver bullets, and they will take time to develop. In the meantime, there are simple things everyone...
Okay, yeah, he basically goes into saying wash your hands and be good hygiene, protect yourself. Now, basically what they're saying is they're broke, and they need money to do this, right? And they're not just speaking to us, as the public. They're speaking to all the world leaders publicly, stressing this to the public leaders, like, hey, we need you guys to come on board with this. If not, it's going to be much worse, and it's going to be costing much more. That's what they're telling people. They're saying to the world leaders, if you don't invest now, you're going to pay more later. So what does that say? Is it serious enough? I guess it is. But are they talking like it's serious enough? Well, the World Health is. You can see their demeanor, and you can see that they're serious, and you can see that they don't know anything about this. And they say, well, we know so much about it when he first said it, right? You know, we've learned so much. Well, he said, but the only thing they learned is that they have the DNA, and yeah, basically that's about it. And they still don't know how it's being transmitted. They still, you know, they don't know much about it at all. They're just totally baffled by this. That's why they're getting this world panel of scientists to kind of come together. But you can guarantee that's happening now, right? They said February 11th and 12th. That's probably an official date, but there's probably lots of stuff been going on in the background, in the back rooms and stuff too, right?
One can do. Wash your hands regularly and cover your nose and your mouth with your elbow when you cough or sneeze.
Don't forget to cover your nose with your elbow. I tried that earlier actually, and yeah, it's not easy.
Hygiene. Keeping the world safe is in our DNA. If countries invest now in prevention and research, we can avoid more cases and more costs down the line. I thank you. Back to you, Tariq.
Thank you.
Yeah, we'll go for some questions here. They're going to question some stuff.
We will go directly to questions. We will take one or two from the room, and then we will go online because yesterday we have not been able to take any. And please, in the interest of having as many people as possible to ask questions, can you please ask only one question and not go in a long list? So we will go 1, 2, and then we'll go online, please.
My question.
If you can just come and press the.
Hello, thank you, Tariq, for Dr. Tedros, Shane from China Central Television. My question is, right now at this time of the day, I remember yesterday Dr. Mike said that the nurses and doctors in the front line are the real heroes. So, but now we also see some strikes in Hong Kong for the doctors here. They just refuse to do the job. So at this time of the situation, what do you think that the doctors and nurses should do to help the patients, and what to call for the spirit to support them? Thank you.
If you didn't hear that, that had to do about the.
This is a time of
Oh my goodness. Yeah, if you didn't hear that, it was a question about the Hong Kong nurses and being on strike and stuff.
You know, there is a common enemy now, a very unknown virus, and I advise all of us that we focus on the virus, the common enemy. I can understand the pressure on health workers, and that's why Mike said they're the heroes, and I fully agree, and I want them to continue to be like that. Thank you.
Thank you very much. Stephanie, one question, and then we will go to.
Because almost all the healthcare staff in Hong Kong are on strike, because nobody wants to deal with this. Nobody wants to be exposed to this and catch it. You know what I mean? They've seen the pictures of their fellow doctors dying. They know what it is. Nobody wants to be in doing this, right? So who's there to deal with this? The health care system's already trashed, right? And it's already overloaded. And now you got people walking off the jobs. So, and that's not even in that's not even, you know, this is in Hong Kong. So, but anyway, yeah, we'll go back to this, my commentary.
Journalist online. Stephanie, please. Please switch on the mic.
Yes, thank you. Thank you, Reuters, Stephanie Nebehay. You've had, I think, about 4,000 cases announced overnight. We're coming out of some of the incubation periods, the upper bounds for some of the incubation periods for some people. Are you getting a sense that we're perhaps nearing the peak, or is it too soon to say that? I don't know if that's rather perhaps a question for Mike. Thank you.
Thank you for that.
So basically what she asked there is if the virus is showing any signs of coming to its peak where, you know, it's going to start dropping down. But you know, as we can all see, you know, the numbers are still climbing. Anyways, we'll let them here to that.
No, I think it's right now too early to make predictions on numbers.
So I'm just gonna stop that there. It's too early to make predictions on numbers. The numbers are all skewed, and you know this. and they're basing their current models off these numbers, and the models are wrong. If the numbers are wrong, it would only seem logical, right? And we know the numbers are wrong. Know that the doctor died there, who tried to break the silence on this and was arrested, him and his colleagues. So China was trying to cover this up. We know that now. News, and he's up there in the left, Dr. Lee. He's a hero, right? He tried to alert the world, and he died. But anyways, let's go on to this. The numbers are wrong. That's my point. The numbers are definitely wrong.
Although we are pleased that the numbers from today is the first day in which the overall numbers of confirmed cases reported in China have dropped. And so we're thankful, and I'm sure our colleagues on the front line in China are thankful for that too. But that is very difficult to make any prediction related to that. We're still in the middle of an intense outbreak, and we need to be very careful on making any predictions.
So they're basically saying in not so many words that we know as well that the data is flawed. That's why they're sending in this tactical team or this expert team to and start gathering actual data as fast as they can. And they're going to get a lot of data too out of these 2 cruise ships. Unfortunately, the silver lining in the situation, the quarantine cruise ships right now, that the people in there will get an understanding of how this is spreading. But we'll continue on.
Can you just clarify what you mean by the overall number of cases reported dropped?
The new confirmed cases.
When you're seeing this in graphs, it looks like the cumulative number looks like the daily numbers are rising, but the actual number reported today compared to the number reported yesterday is actually down on the day, and doesn't mean anything, but at least it's not going in the wrong direction. And equally, we've seen, and we've said this before, there has been that constant increase in cases in Hubei province, but we haven't seen that same acceleration in provinces outside Hubei, and equally we haven't seen that acceleration in Hong Kong and Macau, in Taiwanese people either. So I think again we're seeing a relatively stable situation outside Wuhan, Hubei, but as you said, Stephanie, and you are correct, there are cycles of transmission, and we may see those cases increase in the coming days. But at least for the moment, things are stable. But 4,000 or nearly 3,700 cases of coronavirus confirmed in a single day is nothing to celebrate. It's certainly still a great worry.
Thank you very much. We will now go online.
Like, these guys know how serious it is. They do. But they're going on factual, scientific data and not in yet. That could be our downfall. Waiting for, we're waiting. It's all policy procedure analysis. We are nothing but a figure on a piece of paper in a pie graph somewhere on somebody's desk, and it's like, well, so they can't say they're not going to make decisions unless they get scientific data. So keep that in mind, right? Self.
And please, one question per journalist. Let's try Nurit from NPR. Nurit, we didn't get to speak to you yesterday. Can you hear us now?
Yes, I can hear you. Thanks, I appreciate it. I wanted to ask you about Wuhan Dr. Li Wenyang. He's one of the doctors who first reported concerns about the coronavirus cases back in early January, and who was reportedly arrested by police for spreading rumors. There's a report now that he contracted coronavirus himself, and he has now died. Do you have any comment about this?
Thank you, Nurit, for this question.
You know what I mean? Like, they got to be really careful what they say to the public, as to like not cause speculation. This is the highest of highest level. Oh, but at the same time, you got to read a little closer. Not too much, but they're definitely saying, I think, more up on.
Yeah, we're very sad to hear of the loss of Dr. Li Wenliang. We're very sorry to hear the loss of any frontline worker who's attempted to care for patients, and we ourselves have lost our friends in the front line, so we should celebrate his life and mourn his death with his colleagues.
Thank you very much. We will now.
You know what I mean? Like, they went in and they arrested the doctors. That was the doctor that they arrested. Told him not to talk about it. Right? Like, unbelievable. It's not just him. All kinds of healthcare professionals not officially made headlines on the stage except for him, because you know, he broke the silence on it. There's lots of others.
I'll go to Kai Kupferschmidt. Kai, can you hear us?
Yes, thanks for taking my question. So I really wanted to ask what the situation is, what you can tell me about Africa. What is the diagnostic capabilities that are there? You know, how are things being tested, and what are you doing to make sure that you know, if it is introduced the virus, that there will be, you know, that there is.
That's so annoying.
Thank you, Clay, for the question.
But anyway, I'll repeat it. They're asking about the diagnostic tests being sent to Africa, because as we know, well, Africa is dealing with an outbreak already, and trying to battle this for a year and more now. So it's a big thing for Africa, right? And they don't have the healthcare system. It's scary. So we'll continue on.
So I'll take that question. So thanks for that. So we have a global laboratory network that is meeting multiple times per week to discuss how we can improve and increase diagnostic capacity. There are referral labs that have been identified across the globe where samples can be shipped to support countries that don't currently have the capacity. Secondly, we are working to increase national capacity, and we're building upon the influenza labs that exist globally. And thirdly, we are trying to procure and identify tests that can be shipped. And as the Director General said, more than 250,000 tests were shipped this week. We're also looking for other sources of tests that can be shipped so that those labs that can do diagnostic work, molecular testing, PCR testing across Africa, can detect cases quickly.
Thank you very much, Dr. Maria. Now,
you can tell that they're concerned.
Jeremy Lange from RFI. Jeremy, can you hear us?
Yes, I can hear you.
All this echoing is so
a quick one for Dr. Tedros. You mentioned earlier that some countries are withholding information about coronavirus, or at least not sharing them in due time. And Human Rights Watch, on the other hand, pointed out that China might have been hiding information at the beginning of the epidemic, and make things worse. I'd like to have you comment on that.
If you couldn't hear that, the question was asking if China was withholding information about this. So
Thank you, Jeremy.
We're still waiting data from a number of countries in terms of fully completing their sending of data to WHO, but with
I don't know. Like, he kind of shifted around in his chair there. Did you see that? I don't know. His body language speaks of volumes too, right? Maybe his butt was G. I don't know, but it just seemed convenient that after this question, I'll shift you. But anyway, it's a hard question to tackle, right? You don't want to come out and say, yeah, they were hiding it. So how do you answer that? See how they answer.
With regard to your question regarding China. In terms of data, it's very difficult at this stage to look retrospectively and reimagine what the dynamics of the epidemic were in late December, early January. But from our observation of the situation, China has reported those first clusters in association with the Wuhan market, and did that in an extremely timely fashion. But we don't know the source of the outbreak as such, and we don't know that there may have been 1 or 2 or 3 different animals involved involved and possibly in different settings. What we do know is that the Chinese authorities had a special surveillance system in place for picking up unusual pneumonias. That system was active in Wuhan, and as soon as that system activated with a cluster of unusual pneumonia cases, they were reported immediately to WHO, and subsequent laboratory investigations were undertaken. There's a difference between what may be happening at a community level and what the public health system can detect and respond and report. And from our perspective, the public health authorities in China, as soon as they detected an unusual signal, you can imagine here in China, it's winter, it's the flu season. People with pneumonia, it isn't an unusual thing. 2 people or 3 people, there are millions of people living in Wuhan. So picking out a signal of an unusual event that may be associated with a particular place is not an easy thing to do. It's very easy to look back in retrospect, and it's very easy to assign some kind of easy process that should have been carried out. It is not that easy. The signal was picked up from a very large signal of winter disease and winter pneumonia, and that was reported to us immediately by public health authorities, and for that we're very grateful.
And maybe we see it in other words. As you know, China is the most connected country with the rest of the world. Cases would have made it to other countries if there was a serious hiding in China. Because China may be able to hide what's happening inside, but cannot hide the number of cases in other countries. And as you may remember, when we had cases in China, there was no case in the rest of the world. And when the number of cases was increasing in China, even when we declared FIC, the number of cases elsewhere was not more than 100. Even as we speak, we have outside China 225 cases, while in China we have more than 28,000. So it's very difficult, given the facts, to say that China was hiding, because many Chinese travel, and many cases would have made it if there was a delay. So that's how we understand it. But as I said yesterday, for anyone who wants to know what happened from the start to the end, we will have the after radio action that we will do with China to learn from what happened from the start to the end, and learn from it, and then prevent any problems in the future.
So that's just a whole lot of words that says we can't prove or not prove it, right? You're like, well, it's hard to say. Well, of course it is hard to say, prove it, but then they don't want to alert the public and be like, well, it's possibility, because then the public's just going to go flying right off the handle. But what you can take from that, at the first of this broadcast, they said that they still don't know the source of where this is coming from. And now here he said, I picked up on it, he said that we don't know if there's an animal or multiple, which is kind of weird because they said earlier that they still don't know. But now he's claiming animal. But I don't, what is it, right? It's so much misinformation, but they don't want to panic the public. But here they are saying we don't know anything about this at the first of the broadcast. And now he's saying, well, we don't know, but we're just giving circular, he's speculating, what's that? He said we can only go on factual data, but then he's right? It's not flowing. And then you got the Dr. Lee, who everybody said that the authorities arrested him. Know that the authorities, CNN is documenting that. Oh, it's Dr. Lee up in the left. So we know this, but they can't come out. I don't know. I think that was just a thing. A lot of people are speculating this. If China they start speculating that China is hiding this. The most global masses are suspecting this. Well, that becomes a big problem, right? But they didn't say anything. All he said was, as he said, I don't know, but hard to say. But
outside China, 225 cases.
But then he's saying numbers, right? But then just a couple of minutes ago, in the broadcast, he said we can't take those numbers. for, you know, actual. So why is he back here throwing numbers if we can't use the numbers if they're not accurate? I don't. It's just so much, right? Like, it's like they're contradicting almost everything they say, but not really, but kinda.
While in China we have more than 28,000. So it's very difficult, given the facts, to say that China was hiding.
Right? It's very difficult to say. Of course it is, but all the fingers and everything red flags up to say that they were? Yes? Is this like something that is like totally just out of control? Yes. Is the public on alert? You know, they gotta tread very lightly on what they say, you know, but then he's, you know, almost assuring people, worry but we don't you know, don't worry but we don't know. Well, you know.
Yes, thank you, Tarek. I have a question for Mike based on some comments from yesterday. Mike, you mentioned that you are doing assessments of public health measures, I guess such as quarantine, taken by countries around the world. I wondered if you could talk about that a little bit more. What are you assessing and what you plan to do with these assessments?
Yeah, this question was about asking quarantine assessments of countries and different and basically she asked why he was doing assessments before.
Yes, thanks for the question. The assessment is almost complete. Under the IHR, where WHO has issued temporary recommendations, where countries have exceeded or appear to have exceeded those recommendations, we are bound by the IHR to seek information from that member state regarding the rationale they've used for exceeding the measures as advised in the IHR.
So basically that there is saying, you know, China's use of measures and excessive force by, like, you know, like they're literally like arresting people and like, oh, it's terrible. I'm telling you, just pulling people out of their house. Might be they're just sparking fear, drive them indoors almost. And anyways, let's just.
The IHR does not deny or prevent. It doesn't prevent a country from taking measures, but what it does is it requires the countries to justify the risk assessment and the value of the public health measures from their perspective. And this is a very important balance, because it's very easy to make, very difficult to make a law that can, an international law that can predict every eventuality and every particular circumstance that might occur. So all risk assessment in public health, in some senses, is local. It is depending on the local situation, the local dynamics, the local capacities. Because in some circumstances, countries may feel they don't have the capacity to take one measure, but they do have a capacity to take another measure. So it's like having tools in a toolkit. Sometimes you have a limited toolkit and you have to use it in a certain way. So we have to respect the fact that countries have to make certain decisions based on their circumstances, based on the threat that they perceive, and very often, sometimes, based on community perceptions. The cultural perception of fear for contagion is very different all over the world, and governments have to respond also to community expectations and perceptions around protection of their health. So governments are in a very difficult position. They have a very fine balance to strike, and what we try to do is make that decision transparent, and we share that justification with all of the other member states. So at least other member states see what that justification is. So that's the process we're completing at the moment.
Thank you very much. One more question from online, and we are then back in the room. Anne Gallen from Telegraph. Anne, can you hear us?
Oh, hello. Yes, thanks so much for taking my question. You said one of the things that you weren't sure about was the severity of the disease. And I just wondered now, with all the case reports coming through, whether you have at least other sort of beginnings of an idea of how severe the disease is. I just wondered whether, you know, people really do need to be in hospital, or whether that's just a kind of, you know, a precautionary measure, or whether the disease is more severe than other sort of similar pneumonia type illnesses. Thank you.
What we're seeing from the reports on severity, so as you know, the big things that we're looking at are severity and transmission. And with regards to severity, we have a clinical network that we've pulled together that meets multiple times per week. We have clinicians that are actually treating patients across the globe, and they are sharing their experiences of dealing with these patients. And what we're seeing, what we're hearing from these reports is that there is the full spectrum of disease. You have mild cases, which look like the common cold, which have some respiratory symptoms, sore throat, runny nose, fever, all the way through pneumonia, and there can be varying levels of severity of pneumonia all the way through multi-organ failure and death. So it is that full spectrum of disease. What is important is to determine which proportion of those infected fall in that spectrum of disease. We know that their underlying conditions and advanced age make an individual more at risk for developing severe disease and death. Individuals who are over 60 years old have a higher risk of death. Individuals with underlying conditions like diabetes, like hypertension, unfortunately these are common comorbidities that we see are risk factors for respiratory pathogens, including this novel pathogen. The clinical network is having very detailed discussions around the progression of disease. They're having detailed discussions about what are the certain types of characteristics of these individuals, looking at pregnant women, if pregnant women are infected. And so more will come from these teleconferences, and we will share more as we learn more.
Thank you very much. We go back to the room for...
And we know, yes, there is a pregnant woman infected. There's children. Infected. 2 newborn babies in Wuhan have been infected, according to broadcast. Youngest diagnosed hours. Oh, the mother had to pass it on to the baby. That's massive. Being very transmissible. Oh, you might not get a whole lot. But the fact that it is.
Few questions here. We had one question here, then Elaine.
Okay, Xin from Xinhua News Agency. Can you hear me? Dr. Tedros, since January 23rd, the population of Wuhan has been confined in their city for almost 15 days now. So we have to say they sacrifice a lot for the prevention of spreading the virus. Is there anything right now that you want to say, any messages that you want to send to them at this difficult time for them? Thank you.
Yeah, I think the Wuhan people and Hubei province in general, they are paying a lot. And first of all, I would like to appreciate them and thank them for their cooperation and for believing that the actions they are taking, it protects their people and also it protects the rest of the world. And doing this for humanity is something beyond words.
Doing this for humanity. Yes, it is definitely. You realize the gravity he just spoke there, right? Like he's saying that these people are sacrificing themselves almost so that humanity can survive. In a sense, like this isn't little. This is huge. Way bigger than the. Oh, and it would be an absolute atrocity. Military going and taking already sick and infected people and taking care and let them die. There's no funerals being. Bodies are up so fast. Right, so it's really bad. And I know this, I do, and I think the world's gonna see.
And I am really thankful for that and proud of what they're doing and much gratitude. I was in Beijing and I wish I had visited Wuhan, but I would like to assure the Wuhan people or the residents of Wuhan that I will go and visit them one day, hopefully very soon, but at the same time express that my spirit is actually always with them and with others who are fighting this dreadful virus. And we're in it together, and with this kind of solidarity and thinking for one another, we're one human race. I know we will defeat this virus.
Those are, you know what I mean? That's kind of like a speech. But at the same time, always being a little real there, bro. No matter what the mumbo jumbo through, this thing is bad, and yeah, because and everybody was saying, the reporter was saying, question, how many, like, what's your take on everybody being inside house now, residents, weeks, or almost 2 weeks, and you know, like, you got to think, like, all those people, we don't know if there's, like, a lot of those cases aren't, actually not a lot of them, like most of them, all of them, because the hospitals have to get like a certain, and like, and even then you don't get a doctor, no, you don't get a place to do it. Oh, there's so much that we don't know about this, but yeah, you know, we got everybody saying, "Oh, don't worry, it's all good. Risk is low."
Shishi.
Thank you, Dr. Tedros. Elaine?
You know, like, that's, I'm sure. Like, right. I think he knows the gravity of this. I don't have the science to, right? He knows what's going on. Goddamn right they do. And I think, you know, a lot of people, I'm pretty sure I do, you know, have a good grasp of that it's not, they're telling us, right? Oh,
Please.
Dr. Tedros, Elaine Fletcher from Health Policy Watch. We're seeing a lot of high-income countries imposing travel restrictions, as you've discussed, while many low-income countries and middle-income countries have left their doors wide open. The U.S. this morning in the EB asked if WHO could provide some more technical guidance on what should be done, because people are perhaps very confused, and maybe the countries that are most vulnerable might be left more vulnerable if they don't have any guidance on these sorts of measures they should take. Is there a paradox here with what's going on?
Not at all. Actually, high-impact quarantine measures are some of the most expensive measures to implement that you could imagine.
see, it's money over safety. People are looking at the numbers going, "Oh, it's not that bad. That's not even the amount of people that SARS or whatever. You know, well, we've seen this before." But the numbers are wrong. Everything's wrong, every level. And anyway, you know, it's a money thing. Statistical analysis to say, well, if we do this, you know, it's going to cost a lot. So, but if we do this, it's going to cost even more. You know, so like it's a statistical game right now. Like the whole humanity is nothing more than a numbers game that is obviously really skewed.
And low-income countries have choices to make, and frankly, we've always believed that the real point of entry of a virus to a country is very often in a poorly equipped emergency room, in a doctor's clinic where there's no awareness of the disease. And not necessarily in points of quarantine or points of entry. We do support entry screening and other measures as a part of a comprehensive package. But what we absolutely have to avoid in this case is disease arriving in an unprotected health facility with untrained, unaware workers and having an amplification of disease in a clinical setting. We've seen what's happened with other diseases that do that, be it Lassa or Ebola, in clinical settings in countries with weak health health systems. We know the damage that a virus like this can do in that setting. So we are focusing on supporting countries with weaker health systems to strengthen the key, most important elements of their system. Their ability to detect, their ability to confirm, their ability to isolate cases safely and provide safe care. The last thing we need at this point is the frontline health workers themselves becoming victims of the disease. This is an absolutely important factor. So again, where countries have more resources, they can put in place much more comprehensive measures, and you can argue what the cost efficiency of that is, and you can argue many things. What we want to do is be sure to extract the value from every dollar that's invested through and with developing countries in particular, that we ensure we get the best value for that investment. And yes, we are looking as we speak at a systematic review of quarantine measures historically, and trying to give countries more advice and give them more information as how to make those trade-offs and what is the value for money of quarantine measures and the historical costs of doing that. So we'll continue to push that information to our member states, but we don't believe there's a paradox in that approach.
Thank you very much.
You know, that's basically what the question was, is that they were asking, what about the small countries that are keeping their borders open? You know what I mean? If they shut them down, they're gonna, it's a cost value thing, right? So, you know, if they don't have anything going on right there, maybe in those countries, so they're keeping their borders open, but it could be coming in, right? Just as with the rest of the world, you know, only certain countries are closing their shops, like a lot of them are now, especially international.
Let's go now back to our journalist online. Can we try, Chris, please, to get Helen Branswell?
Hi, yes, thanks very much. Can you hear me?
Yes, Helen, go ahead. Helen, go ahead.
Okay, thank you very much. I wanted to find out more, if I could, about mild cases. Is the picture coming into focus at all about whether mild cases are transmitting, and you know what potential they have to drive this outbreak outside of China?
Her question there was about people who were showing little to no signs of infection, like, you know, no temperature, no fever, or anything like that, and asking if those people can still spread it and what we can do to stop it.
Thanks, Helen. So yes, I mean, we're learning. There are some studies that need to be conducted, and these are studies. These are virus shedding studies, and we need to look at mild individuals all the way through severe individuals, and that systematic data collection and sampling of mild cases as well as severe cases is something that's really urgently required for us to get a clear handle on this and to quantify the amount of shedding that is happening from mild individuals to severe individuals. We do know that mild individuals shed virus. We know that severe individuals shed virus. Which proportion of those that drive this outbreak, it needs to come into more clear focus. We know that the more symptoms you have, that you are more likely to transmit.
You're more likely. Right? They have no idea. They have no idea. They're basing everything what they said, you know, off basic, you know, like history things, and which is, I guess, is all we have to go on. You know, it's not irrelevant information, but really, it's not. You can't. You know, what else would they say, right? They'd have nothing to go on if they didn't have past data. But anyways, that, you know, they're saying they still need to do more studies, and they do know that it is being shed from people have symptoms and people don't, but they don't know the ratios now. And I don't think the ratio really matters. They just want more data, and the time is ticking by, and this thing, we don't know who has it, we don't know who's transmitting it, but it just keeps shedding and it just keeps spreading. And you know, I don't know, but they say, you know, it's a big thing, but don't worry.
This is a respiratory pathogen, and so transmission is through droplets, through close contact with droplets. But we do know that individuals that are mild also have respiratory samples. So this data is something that is urgently needed, and we advocate for countries all over the world, if you have cases, to collect this type of information from your cases so that we can quantify this.
You know, like, the information isn't even coming in across the world. So what the hell's going on? You can't even get organization at the, obviously it's a panic situation in like in the healthcare system in places. It'd be really stressed everywhere now almost. Everybody's getting prepared and everybody's, there's big things happening. There's a lot of things moving and shaking right now. So, that combined with, trying to get the accurate data in a timely manner to the people who need it is even more of a challenge. So, we got to take this into our own hands and kind of take, and be prepared, get stuff ready, because it could come down quicker than you could ever imagine. And that's what happened in China. Exactly what happened in China. But they covered it up. But still, regardless, we're waiting for data. It's still time ticking away regardless. So we'll finish watching this.
We're also expanding collaboration, and again, the DG mentioned that the R&D work that's rolling out as we speak is based on years of investment in the R&D blueprint platform and with our partners. Well, this work on coronavirus is built on 70 years experience in influenza surveillance. So we're building on influenza surveillance, building on a massive network of influenza labs, linking them with emerging disease labs and coronavirus labs, and effectively going to use those antennae that we have in the global system, listening posts, to see if this virus is pitching up in a broader community sense. We can't wait for the serology tests to become available, because at the moment we can only test for the virus, as in the particles of the virus in swabs from the patient. What we can't test is someone who's perfectly well, whether they've had a recent infection, and we need serology tests, blood tests that can test that, and we can look at the overall population attack rate, how many people in the population have had the infection, and then we can make the comparison with severity. We don't have those tests. We've hardly known this virus for a month. It's incredible that we have PCR tests. It's incredible that we're able to diagnose it, but we need the serology tests to be able to do the broader population-based study. So there's still much to be learned, but we have, as I said, a lot of capacity out there. We need to put all of that capacity to use to learn more about the actual impact of this disease at community level.
They're calling on all the universities, all the top scientists, anybody who has the means and the resources to figure this out or come to, give more data on it, and then they got to get more data from the field. You know what I mean? They don't have nothing to go on except what China's given us. And the numbers are off. We've seen the videos. It's just a shit show level. And, they're waiting on science. That's what they said. Gotta wait on the data. But now they're putting out this, global surveillance. I'm not sure what that is. But they mentioned that they're going to start doing, a global surveillance. And that's part of the strategic response plan. So who knows what that entails? Maybe it's satellite pictures of villages. Maybe people are dead in the villages that I could see. You know what I mean? Something like that, or aerial pictures, or who knows. But it would be surveillance, to see if on a global level, see if this is affecting more places, whereas they can't report it or not reporting it. So it's a lot, right? But they don't have any data. They have nothing. And yet they're giving public health awareness and safety advice, based on what we do in the past. But they say, hey, we have no idea what this is. We need more funding. We need more scientists. We need everybody on this. But they're not saying it in such a way that's panicking the public, but they are saying it. And this is not just a message to the public. This is a message to the world leaders. The world leaders are all, they're all watching this or there. So it's a meeting of the world leaders too, right? On a health level.
Can I pivot back to the research meeting next week? So this is exactly this meeting that Dr. Tedros mentioned on the 11th and 12th next week, of bringing together the world scientists, public health professionals, individuals who are treating patients to come together and say, what are the most critical things that need to be done? This is one of them, but there are many.
Thank you very much. We have time.
He didn't cover his cough there. Did you see that? They're telling us to cover our coughs and use our elbows to cover our coughs, and he's outright just fucking. I don't know.
For one more question, let's go to Ronnie from New York Times. Ronnie, can you hear us?
you. Line's much better today. Do we have any clear data? I know you've mentioned people over 60 being more vulnerable with people with underlying conditions, but do we have anything else about the demographic breakdown? Men seem to be getting more affected. What kind of data do we have from confirmed cases in China?
Okay, if you didn't hear that, he was asking if there's any real science behind the fact that people are saying this is affecting their or more weaker with underlying issues more than others. I have to say with that, that's actually a really good question.
Thank you.
So yeah, so I mentioned that
Data, gender and age and...
So we have some data from Chinese authorities around age that I mentioned, the older ages. We have seen a breakdown of advanced age, and it appears even over.
Okay, but they said we have data for Chinese authorities. That's what they said. Okay, so right there, early in the broadcast, they said, well, the data's not right, so we have unconfirmed data, is what she should said.
Over 80 is the highest risk factor. That increasing age increases the risk for death.
Well, we know that in general of anything. You know what I mean? Even strenuous exercise is going to be more dangerous to higher with underlying issues, right? Like that. Like that's nothing. Yeah, but they still know nothing about it, and you have people asking questions about what about it. We don't know. The data's not there. How they said that. That's huge. That was a big broadcast. That was kind of a long go through, but yeah, it's a lot, right?
Thank you very much. So I think we will have to stop here and.
Yeah. You know what I mean? They don't know nothing about it. They're giving public health advice, and especially not just public health advice, but advisories, advising people, saying, well, the risk is low, don't got to worry about it. It's wow, a lot, right? And this fella, oh my god, like where do you even believe the information? Because everybody's, two babies infected. So it was passed on from the mother, right? They're saying the earliest one was 30 hours old. So that's a big thing as how to determine how infectious it is, right? But we don't really know exactly. Just China give whatever the hell giving us, and they're telling their people that there's only 4 cases officially. Bullshit. Yeah, let's see if they jumped up. Anyway, we'll do a quick check on here. Yeah, you know what I mean? It's fresh this. Numbers don't matter, but we're just gonna take a peek. I thought they were gonna crack 30,000 before midnight last night. But it's the numbers are wrong, right? We know that. We got in Tokyo, we got 45 cases confirmed in Tokyo. Little World Health Organization aims to speed up research on coronavirus at global forum next week. Like it's just spreading in the meantime, but they're waiting for more data. They can't. It's like, oh, we got no data. We just gotta keep going, spreading. But I'm sure they'll give us updates as they find out more stuff, right? And like most other countries, scientists are on board with this right now at the moment, and they still haven't figured it out. There are questions we need answers to and tools we need developed as quickly as possible. DG, Director General. We don't think we have a week. I don't think we have a day. No. You know, the more this gets to spread, like the harder it's going to be to contain, like a fire, right? If you just sit there and watch the fucking fire get bigger, it's going to be harder to put out in the end. $200 test kits. CDC will distribute 200 test kits. 200. Each test kit can perform 700 to 800 patient samples. Okay, so we're looking at 160,000 people, or let's say 150,000 people, that these tests. So 150,000 people in these test kits. That's not very much. I mean, like I guess it is, you know, but for a city of like millions and other countries with tens of millions of people, that's not a lot. About the test. It's known as a reverse transcriptase polymerase chain reaction to detect the virus from nasal swabs when used with existing RT-PCR instruments. Same one often used to test. Negative results do not include infection of the virus. The FDA noted in a press release, adding that negative results must be combined with clinical observations, patient history, and epidemiological information. FDA issues an emergency use authorization on Tuesday for the test, though it is not technically FDA approved. Well, you gotta go with what you have, right? Yeah. 12 confirmed in the United States. Yeah, they're on their way to 13 and 14 very soon. Canada's on its way to 7th very soon. People waiting for our tests to come back. But that, you know, that might seem like super low numbers, but those 6 people can infect. Each one of those people could infect 4 or 5 or more people. You know, each one of them. So now you got like 30 or 40 people, and now each one of those 30 and 40 people can infect like 5 or 6 people, or 4 or 5. Now you got like, see how exponentially that grows, and it's like you can't see this. You don't. It's invisible. You know, they said it very good in the World Health Organization that you know, it's a common enemy right now. And 100% is. Well, this guy tried to blow the whole story. Tell the doctors, you know, Chinese whistleblower doctor tried to warn the public, and then they arrested him. And of course, well, he contracted it, and now he died. Has died. It's very tough to detect. And they're going on scientific facts, and they're statistical people. Even if they've seen the world melting down around them, unless the numbers are in or the scientific data's in, they're, you know, well, we're not going to do nothing. But that's this protocol, and policy is in place for a reason, and you can bet that other people are fighting to keep this from not closing down like other countries. It's just a board of world leaders. They vote on whether to do things or not, and if scientific evidence isn't there, you know, the vote's not going to get cast usually, right? They want to keep this going. Money. You know what I mean? So it's a lot, right? It's a lot. Always constant news updates out. But a lot of people on these cruise ships, right? And out of the first 71 tests that came back, 20 people are infected from the first 71 tests out of thousands. So you can expect that number to jump exponentially, and I think we're going to get a real good data on if there is any silver lining in this situation. It's that you're going to understand how quick this thing moves. And yeah, we're not seeing the deaths, we're not seeing the numbers, China. And you know, one can speculate and one can wonder and see what's going on. Scientific standpoint and actions of the World Health said that. know, he said that is the downfall. You know, like unfortunately, we have to make a data decision. Now we just can't assume. We need facts before we can, you know, even if they believe it 100% or wholeheartedly as well, that they need factual data before they can release a statement. Like, gotta remember that. You have Chinese doctors. Everybody's saying this is bad. This is bad. Bad. No, they were saying it right from the start. I've been saying it from the start. I'm not a scientist, and there's no positive data. But anybody who wants to refute against this, they're going to be like, "Oh, it's a bunch of bullshit. Data's not there, so it doesn't matter." You know, those are going to be one of those people. You know, world's burning down around them, and oh well, no. The news didn't say it. I don't. You know, it must not be real. It must not be happening. I'm going to work. Fuck. But it's huge, right? It's huge. All this. And the markets are only staying afloat because China liquidated all their fucking assets. China confiscated the central bank assets and liquidated them and pumped it all into the markets just so it would look good for a little while. But it's not. It's gonna pull out pretty quick. It's only going to keep them afloat for a couple of days, right? Because the markets opened on Monday, and like they were thinking, oh, you know, yeah, they were trying to get the world to keep investing, but Nike pulled out, Apple pulled out, Boeing pulled out. Like, you know, it's just a pull out fest over there right now. Yeah, for industrial or production, right? It would everything you can't, you know, export or import anything if everything's closed, everything's shut down, travel, everything. You know, from exporting, nobody's taking anything from China right now. Nobody. All the borders are closed. So, yeah. Oh, it's big, and the world is, and they're like, oh well, you know, and they keep quoting these numbers, but then the World Health Organization says, you know, actually, not right at all. We can't guess. Oh, but we know they're bigger, a lot bigger. And while we're waiting for scientific data, I think it's just testing the world. Data will be the downfall. China tried to hide it. That was their downfall. We're waiting for data. It's our downfall. Right. There's all kinds of stuff coming out. I'm gonna take a break here and start up another stream. Yeah, share and get this out there. World Health Organization is just, you know, like, wow. They're statistical based people, right? You're just a number on a piece of fucking paper right now. They're putting the the world's population in, you know, mathematical equations and deciding what comes next. Yeah, so remember that, right? Take your own in your own hands. Don't depend on the government to tell you when to go or when to run, because they won't. With that being said, thanks for watching.